What's up, guys? It's Matt. All right. So, my video that I promised you guys, that's the second half to my last video. I don't know what happened. It got messed up or something, so I don't have I lost the video, basically. That was the result of my sim, so I'm going to do that now, and then I will stitch these two together and upload it. So, basically, I was pretty upset at myself. This was not a graded simulation. It was more like our instructor wants to get like a feel, make sure we're all at least on the same or right path. He didn't expect anyone to do it perfect. And, you know, he kept changing details of the scenario to, like, keep you on your toes. Me, though, I went last, and I also went solo. So it was designed that there would be 2 therapists per room, but it was the odd number out. So I wound up going by myself. And I guess I was just a little too confident. I was trying too hard to predict what he was going to do instead of, really the basics, assessing and observing and seeing what the heck is actually going on. And I think I was just so excited to, in a simulation type environment, to do something as arbitrary as assembling a nebulizer and administering a nebulized medication. And I guess it's not that arbitrary, because it was kind of that thought process that got me in trouble anyway. So basically, I enter the patient's room. I did not look at the chart beforehand. I brought the chart folder in with me. Now, granted, guys, this is a simulation. We don't have a computerized charting system for a simulation in our little lab. So it was just a binder that had notes. And I flipped, looked at, the ABGs, looked at the patient information, all that kind of stuff. Like, the basics, what we're always supposed to do. And then, for whatever reason, I did notice that part of what he did to kind of fudge me up was he pulled the orders sheet out of the chart. So it would be like if you were on a computerized charting system and there was no orders tab to click on. Now, my nerves were a little shot. I tried to go in, play it cool, but I was a little nervous, and yeah. So what I had done is I had actually looked at what was the Mars sheet, and that's where I got a dosage and a medication name, because it was on the medications that are previously distributed. So at least I was able to justify the reason for doing it to him after the fact, because but even on that, he was almost attempting to clue me in that I was missing something, because as I'm going, obviously we're doing assessment, and I'm stuck the pulse ox on the finger. I go to listen to the breath sounds and monitor respiratory rate. And obviously, like your patients, they're not actually desatted at all. They're satting normally 97, 98. So I'm like, all right, well, the patient stats are 97. And I look at them to get the cue of what they're actually satting. Oh no, she's satting 89. Now, as I may have mentioned before, this patient is was admitted to the hospital for shortness of breath secondary to COPD. As you guys probably know, COPDers I have a average OSET between 88 and 92. So, on top of the fact that I didn't have orders, he's kind of cluing me into like, oh yeah, she's satting normally for a COPD. And again, I think I was just so like pumped to want to try to do a damn nebulizing treatment that I, basically just, it escaped me. And now granted, I don't know, maybe she would still just want it if she had orders, but there were no orders. So that is how my simulator. Otherwise, I mean, he said everything else went fine. He had coached the actors in my scenario to not be totally non-compliant. Like I didn't have to put them on a mask. But the patient's daughter, the actor playing the daughter, asked a ton of questions. The patient asked a lot of, well, do I have to? Do you have to? Just I'm okay with that kind of stuff. I worked in retail a really long time. I'm pretty thick-skinned, and I don't mind answering the same question over and over again. I don't mind dealing with people who are playing up a little bit of non-compliant or toughness or whatever you want to call it. But yeah, I was beating myself up pretty hard about not having orders, and actually another one I'd missed about. I caught this one halfway in the scenario with a little help of the patient's daughter. And keep in mind that these actors are just, they're other students in our class. They're not like random people. She was like, "What the heck is this?" And she had the other end of the nasal cannula, and it wasn't plugged into the wall. And that one, it's just, we're so conditioned. I see the nasal cannula. I actually checked the cannula like on the patient. I verified that it was like put in her nose correctly, not upside down. Wearing it like a bolo and not like a damn choking hazard like some people do it behind the head. So I actually checked that, and I heard the flow meter on and gassing, so I just assumed it was on, and then about halfway through the scenario, I'm like, whoops. Now we're kind of laughing about it on our Facebook page for our class. The girl who's playing my patient, she had tagged me in a post, and it was from Office Space, and it was the boss going, "Yeah, if you could check that, make sure the nasal cannula is connected before you call me, that'd be great." And so so we're having a laugh about it now, but I was pretty distraught about it at the time. But my wife kind of told me, "Hey, like, you're a student. Sounds like you were a little too confident. You really need to be scared." She's like, when you go in, you really need to be scared like crapless. Like, if you're not scared crapless going into clinicals, if you're not scared crapless going into sim, like, you're gonna make mistakes. As an RN, she's seen a lot of it. I mean, she saw it when she was in nursing school, of course, but she's also she's one of the trainers in her unit, or preceptors, I guess you'd call them, for all of their new hires, be they new grad or just new to their department. But particularly with the new grads, you get people who are just confident, and they think they know it all, and then they don't ask questions, and then they mess up, and it can be minor, it can be major. And she said you got to be really careful with that. You need to be scared, you need to be worried, you need to be nervous. You're not doing that every day. You haven't even started clinicals yet. So, anyways, that's how my simulation went. Procedurally, my teacher, again, he said I did really good with the patients, given their level of compliance. He's like, it's hard, your sterile technique, the patient had a MRSA positive ulcer. So, PPE was on point. Sterile techniques as far as handling and assembling the nebulizer, he said you did great. Leaving the cannula in, maintaining the oxygen that they were prescribed while hooking up the nebulizer to med air. He said you did great. He said you did everything great that you did do, whether or not you were supposed to do it or not. So, anyways, guys, that's it. That's the result. I'm on to class. So this happened Thursday. I'm recording this on Monday, so I will try to get this all stitched together and uploaded later today. If not, it'll be up Tuesday. So, anyways, guys, as always, take care. Have a great day. Thanks for watching. Like, subscribe, comment, and I will talk to you guys soon. Bye.